This week we sent our own Ainsley Earhart to Chicago to investigate allegations of patient dumping that have rocked the University of Chicago Medical Center. Now, the former administrator at the heart of this controversy, none other than the First Lady, Michelle Obama. Let's take a look.
Before you buy into Barack Obama's universal health care plan, you might want to hear about a little-known medical program key members of his administration started on Chicago's South Side. It's called the Urban Health Initiative, and it's been stirring up quite a controversy in the Windy City. The program began in 2006 as the brainchild of First Lady Michelle Obama when she was the VP at the University of Chicago Medical Center. Its mission to provide quality care to the area's poor and streamline the hospital's ER by directing non-emergency cases to nearby clinics. Despite numerous phone calls and emails to the medical center, we were denied interviews with any of the program's employees. But we did talk to a former student at the university's medical school who is familiar with the initiative.
This program helps by helping to identify people who are using the emergency room in ways that really aren't appropriate because they have no other option. And it helps wed those patients with a far superior patient-centered medical home model. That's the biggest win-win situation there is because the patient benefits and the healthcare costs go down. But it requires some investment.
To get that investment, Michelle Obama, along with close friend and future Obama advisor Valerie Jarrett, hired, you guessed it, Obama spin doctor David Axelrod. He began to wage the initiative's PR campaign. It worked. The good press surrounding the program helped the hospital win a $23 million grant. And even today, the initiative continues to be the beneficiary of government funding. It received $190,000 from the omnibus spending bill, which is on top of the more than $50 million in tax breaks the hospital's given every year. But now critics are asking whether redirecting patients helps the poor or the hospital's bottom line. The program certainly provides the university physicians here a convenient way to focus on their wealthy patients and push the uninsured out the door. Last year, 12-year-old Dante Adams was attacked by a pit bull. His mother immediately took him to the university's emergency room. However, the staff was more interested in her insurance provider, she says, than they were in treating her son. After learning she has Medicaid, Dante was promptly redirected to a hospital an hour away. The incident caught the attention of the American College of Emergency Physicians early in 2009. They issued a scathing press release criticizing the Urban Health Initiative, saying, quote, "This is a dangerous precedent that could have catastrophic effects in poor neighborhoods across the country." A few months later, a 78-year-old Medicare patient died in the waiting room after nurses failed to register him for almost 4 hours. Unfortunately, these experiences are far from uncommon. The Chicago Tribune reported that 32% of patients redirected from the university's ER are poor or uninsured. And people we interviewed outside local clinics said the university would be the last emergency room they would visit.
I know several people that have had a personal experience. It took them a long time to see them, even just to register them. It took a long time for that, and they were like excruciating pain.
Before I go to the University of Chicago, I'll think of other hospitals that are probably further out of the area, which the University of Chicago is like one of the closest hospitals to my home. I'll pass them and go somewhere else.
According to community activist Shannon Bennett, this has led to a backlash among Southside residents.
We hear about what the university is saying as their purpose of what they want to do, and we see something different, and what we see different is that our community been left in the cold.
He's also skeptical of the program's claim that patients directed away from the hospital are receiving better care at local clinics.
They are not getting better care, and part of what the issue is that these clinics are usually staffed by the county, and to my understanding, that service, of course, is nothing comparable to what you're going to get here in Chicago.
Healthcare professional David Catron has spent over 25 years in the business and agrees with Bennett's assessment.
The Urban Health Initiative is not about charity. It's about reserving beds in the University of Chicago Medical Center for well-heeled, well-insured patients.
In fact, he goes even further, calling the initiative a patient dumping scheme, a practice outlawed by President Reagan back in 1986.
If it doesn't violate the letter of the law, it certainly violates the spirit of the law. It is patient dumping.
So what's the potential fallout? A similar practice was exposed in LA 3 years ago when surveillance videos caught a hospital kicking homeless patients out onto the street. Using that as an example, the university's medical center might be brought up on formal charges and face a huge civil penalty. For now, at least, it's business as usual, and the university continues to receive federal funding. But legislators are taking note. Democratic Congressman Bobby Rush registered a congressional inquiry into the university's alleged patient dumping practice, writing, quote, "I am concerned about recent media reports that allege that the medical center is turning away and refusing treatment to low-income, uninsured patients." Republican Senator Chuck Grassley also called for action over a year ago. The two recently got together to share their concerns.
In the case of this hospital, there was accusations of patient dumping. Congressman Reich came to me. We visited about this. We're thinking in terms of legislation on the health care reform bill that's coming before Congress.
Last month, the Urban Health Initiative held a forum to address such concerns, but all that came out of it was a desire to repair their relationship with the community. The medical center continues to insist that no one gets turned away from care. Maybe that's because Southside's poor think they'll just be shown the door. So why should Americans be concerned?
The Urban Health Initiative was developed in Chicago, which is the hometown of the Obamas. If they will develop a program like this for their neighbors, what are they likely to do for us out in flyover country?
With health care high on the presidential agenda, we will soon find out.
We are going to pass health care reform. Not 10 years from now, not 5 years from now. We are going to pass it this year.
And joining us now, Fox News correspondent, our own Ainsley Earhart. Ainsley, great report. I followed this story for a long time. So basically this is patient dumping.
Well, you know, which is illegal under Ronald Reagan's plan. It's illegal to patient dump, and a lot of folks that we talked to in Chicago said that this is patient dumping, and legislators are starting to take note of this, Sean.
Right. All right, but here's the issue, because it's Barack Obama, it's Valerie Jarrett, it is David Axelrod. They ran it like a political campaign. They went into the churches, they went into the community, told everybody, no, this is the greatest thing in the world. But they did it so the hospital could make more money.
All right, so they say it's the greatest thing in the world. Well, we went to Chicago. We talked to folks to find out what they thought about it, fair and balanced. We talked to different people. They all say that they're not for this, or the folks that we talked to at least. In fact, one woman said that her child, 12-year-old child, was mauled by a pit bull, a dog, took the child to the hospital. They turned him away, gave him a shot, said, "You're fine, go home." Child was not fine. The mom was unhappy with the health care assistance that they got there at the emergency room, so they drove an hour away to get surgery. The child was mauled.
You see, there's an audacity here by the Obamas in my mind. In other words, they're trying to convince the world, oh, we want every American covered, blah, 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 blah. And in the meanwhile, they did this. They benefited financially because her pay went up significantly when he became a state senator at this very hospital.
People are just very skeptical of this plan, at least the folks that we talked to. We wanted to, you know, make it fair and balanced. We wanted to talk to everyone there, and the people we talked to are unhappy with this.
All right, it's a great report. Ainsley, as always, we appreciate you being with us. And that is all the time we have left this evening. As always, thank you for being with us. We will be back now tomorrow, our normal time, 9 p.m.